Exercise 4. What other non-infectious diseases are common among women? Can you suggest the causes? Are they curable? Put all possible questions to get the answers given below. Some common cancers of the women reproductive system. Question 1. What is breast cancer and why is it dangerous? Breast cancer is a common cancer in women and is one of the leading causes of death from cancer among females. It is especially prevalent between the ages of 55 and 74, and usually does not occur before 35. Breast cancer kills 3 times as many women as uterine or ovarian cancer. Spreading through lymphatics and blood vessels to other parts of the body, including the lungs, liver, bones, adrenal glands, and brain. The most common route is through the lymphatics that lead to the axillary lymph nodes. Question 2. What are the early symptoms of breast cancer? The warning signs of breast cancer include a hard lump in the breast, a change in the shape or size of one breast, a change in skin texture, discharge from the nipple, itching or other changes in the nipple, an increase of the skin temperature of the breast, and the breast pain. Self-examination of the breasts and regular physical examination are highly recommended by physicians as a way of early detection of these warning signs. Question 3. What are the treatment methods for breast cancer? The type of surgical treatment for breast cancer depends upon the stage at which the cancer is diagnosed. If the diagnosis is made early, the cancerous cells can often be removed successfully by a lumpectomy, in which tumor and axillary lymph nodes are removed. The most drastic surgical treatment is a radical mastectomy, in which the entire breast and underlying fascia, the pectoral muscles, and all the axillary lymph nodes are removed. This is performed only as a last resort. Less drastic procedures include a modified radical mastectomy, in which the breast and axillary lymph nodes are removed, and a simple mastectomy, in which only the breast is removed. Chemotherapy and radiation therapy are frequently used in conjunction with surgery. The current favored treatment for early breast cancer is a lumpectomy and postoperative radiation. Question 4. What is cervical cancer? What are the forms of the disease? Cervical cancer is one of the most common cancers among females. When cancer cells invade the basement membrane and spread to adjacent pelvic areas or to distant sites through lymphatic channels, it is classified as invasive. When only the epithelium is affected, it is pre-invasive. If detected early, pre-invasive cancer is curable 75 to 90% of the time. Question 5. What are the symptoms of cervical cancer? How can it be diagnosed? What are the treatment methods? While pre-invasive cancer produces no apparent symptoms, invasive cancer is characterized by unusual vaginal bleeding or discharge and postcoital pain or bleeding. The most effective method of detection is Pap test, Papa-Nicolau stain slide test, a microscope examination of cells taken from the cervix. Advanced cases of invasive cervical cancer may call for a hysterectomy, the surgical removal of the uterus. Question 6. Where do ovarian cysts occur? Are they dangerous? Ovarian cysts generally occur either in the follicles or within the corpus luteum. Although most ovarian cysts are not dangerous, they must be examined thoroughly as possible cancer sites. Question 7. How are follicular cysts formed? Follicular cysts are usually small, distended bubbles of tissue that are filled with fluid. Ordinarily, small follicular cysts do not produce symptoms unless they rupture, but large or multiple cysts may cause pelvic pain, abnormal uterine bleeding, and irregular ovulation. Question 8. How do follicular cysts behave during menopause? If follicular cysts are present at menopause, They secrete excessive amounts of estrogen in response to the increased menopausal secretions of other hormones. Question 9. How are granulosa luteal cysts formed and why are they dangerous? Granulosa lutein cysts are produced when an excessive amount of blood accumulates during menstruation. If they appear in early pregnancy, they may cause pain on one side of the pelvis, and if they rupture, there will be massive hemorrhaging within the peritoneum. Granulosa lutein cysts in non-pregnant women may cause irregular menstrual periods and abnormal bleeding. Question 10. How are ovarian cysts treated? Because most ovarian cysts disappear of their own accord, typical treatment consists of observation to detect early malignancies.